We were just talking with Raymond about his experience that he had with his foot neuropathy, his leg pain, and the injuries that he had from his low back. Now this here is the picture to your left here is an example of a side view of a normal spine. Those green lines outline what the normal curves in our spine should be. Posturally, we should be straight from the front, but curved from the side. This was an x-ray we took of Raymond when he first came in. Green is normal, he is red. Now, besides this dramatic forward leaning that he has in his posture, if you look at his low back here, he's got this reversal of his normal lumbar curve. He's lost that shock absorbing arch in his low back, and that's putting all this stress on the nerves that come out of here that sends strength and energy into his leg and his foot. So he was getting leg pain and neuropathy in his feet. So we wanted to see, once we looked at this, we'll look at the next x-ray. This is a close-up of what we just looked at. This is green is normal and he is red. This is a close-up of his low back. He's supposed to have normal discs like that at least, but you barely see any disc here, any disc here, any disc here, and very little here because those discs are degenerated, unfortunately, because of so many years, literally decades, of being misaligned. So we want to say, all right, is this improvable? Could we make some correction that could be meaningful to him in his life? So we give him one adjustment, and then we put his spine under corrective stress. This picture, we have an appliance here, what's called a Deneroll, that pushes more curve into his spine. We push him into, say, okay, Raymond, what can you tolerate? We push his curve back in like that. And we take this x-ray, it's called a correction potential film. And we can see his loss of curve here improves, he gets some arching. Now, in order to get it accomplished, we've pushed him way forward like that to get it, and we know we'll have to accommodate that during the correction, but it shows that we get some correction. Let's look at the numbers on this. The normal curve in the spine should be minus 40 degrees. This would be plus, this is minus. If we're standing neutrally, we should have a curve in our low back that's minus 40. That's the normal value. When he first started that initial x-ray, he's at minus 15. Wow, he's lost 62% of the curve. But when we put his spine under corrective stress, he can get as high as minus 28. It's not minus 40, but it's a whole lot better than minus 15. So we're saying, okay, we know he has the potential to make a correction. There's another important measurement, is the measurement of his pelvic angle. It's called a sacral base angle. It's supposed to be 40 degrees. His initial x-ray, when he's just standing neutral, is only 21 degrees. So we put him under corrective stress, we push this forward, he goes all the way to 37. Fantastic. Now we know we have to accommodate for the fact that we're pushing his cage forward. We'll use straps, we'll improve the strength in his abdominal muscles, all of that will help. But the correction potential film tells us that it is an improvable situation. And he had talked about in his video about how inspiring that was for him to give himself at least some hope. Okay, let's see what happened here. So we set up once we established that it was improvable, we created a program for him where we gave him specific chiropractic adjustments. We did therapeutic exercises where he pushed the cage forward repetitively. We taught him how to do that. We also taught him how to shift his cage to the side because his cage was way over here, his chest, and it'd be really hard to get the curve in unless we got it back to the center. So we teach him a different therapeutic exercise to push him this way. Then we do both an in-office traction where we're tractioning him like that, and we're holding that for 15 minutes, supported by a home traction unit, a Deneroll, that he lies on twice a day for 20 minutes. It's a comprehensive program of correction. Now, this was the original x-ray we took on March 5th. And this is the very, very low back here. We know that green is normal, he is red. So he put him under corrective stress, and we're really just trying to get these red lines to come closer to the green. Now you see that he's got more curve down here. There's still a problem here. We'll look at the numbers in a second, and we see that pushed forward a little bit more. We expected that from the correction potential film, told him that that's what's going to happen, but we get more curve. Let's look at the numbers. The arch in the spine this way is supposed to be minus 40 degrees. He started off at minus 15. The correction potential film said he could get to minus 28. minus 26. Fantastic. And that improvement in the arch made a big difference in terms of the amount of stress on the nerve going into his leg, and that's why he got the relief in his thigh, and the nerves going all the way down into the feet. So that was a big win. The angle of the pelvis like this is supposed to be 40 degrees. He was at 21.4. It got to 26. We know the correction potential was 37. So he still has quite a bit of correction that he can obtain there. In his mind, he's like, boy, I could get even better if I keep working on this and keep spinally correcting. And if we look at the individual disc itself, these are the pinch point discs. These are the discs that are sending the nerve supply into his leg. The bottom disc is supposed to be minus 33 degrees. He was minus 27. Wow, he went to minus 33. That's where he got a lot of his relief. The one above it is supposed to be minus 19. It's minus 8.9. It went to minus 13.2. Also a nice improvement. When we have a situation where there's so much damage in the spine, causing true neuropathies, true nerve compression syndromes, if we can improve the posture, reduce the subluxation, take the stress off the nerve, then the patients can make really substantial, meaningful, profound changes in their life by reducing the symptoms. And that was Raymond's story.